ma'am, good day. So for today, I will be doing my return demonstration on the wound care. So first is I'm gonna review the medical orders for dressing change procedure. And the next is I'm gonna explain the procedure and instruct patient to not to touch the wound area, most especially our wound, our sterile supplies. And the next is I'm gonna close the room and the cubicle curtains, including the windows. And then next is I'm gonna position the patient in comfortable position and drape using a bath blanket and only expose the wound area. So yeah, this is the wound area. And then after that is I'm gonna place the waste receptacle and within reach in the work area so that it will be easy for me to throw or dispose the soiled gauze. And then after that is I'm gonna apply face mask or eyewear if required, and then wash your hands thoroughly. So I'm done washing my hands with soap. So I will just gonna use an alcohol to sanitize my hands. It is also to prevent from microorganism transferring to the patient's wound. And then after that, I'm gonna put on clean gloves or disposable gloves. And then after that, so next, and then after that is I'm gonna remove the tape, the bandage, or the ties. So I have here a cotton with a wet cotton ball. So I will be using it in removing the tape so that atong pasyente dili sakit sa iyang panit pag remove sa iyang sa plaster. Kaya na magay possibility nga matapot siya sa ato ang kuan panit, then atong panit is nabi siya bukog, so sakit siya pagtangit. And then make sure to remove the tape in a parallel style to the patient's skin. And then pull toward dressing. And then remove remaining adhesive from skin. So like for example, kanang mura siya like magara, so naman na siya skin nga murag makat. So ato na siyang i-remove para so mag-use ta og sterile ni siya. Ma'am, ako ikat ning nga skin ma'am ha, para kung mamala na yung musuma, dili siya sakit pag Glove hand, carefully remove one dressing layer. And then at a time, taking care not to dislodge the drain or the tube. And then keep soiled surface away from the site on the patient. And then after is pag-observe nato sa wound, if ang tape is natapot siya dito sa naidugo, so no need na nato siyang i-use og cotton balls na wet para ma-easy to to remove. Kay wet naman siya, so para dili magkaano. So easy to siya remove and then dispose sa waste receptacle. And then, after is make sure nga once ma-remove na nato ang tape, bandage, or tie, make sure nga i-observe nato ang characteristic and the condition of the wound. And then, remove soil dressing in the waste receptacle. So, I have here the waste receptacle. And then, dispose glove inside out in a waste receptacle. Then after disposing my clean gloves, I'm gonna prepare all the sterile equipment or supplies. I already prepared here. We have the gauze, the cotton wet balls with betadine, then my forceps, we have an alcohol and a dry cotton balls. And then make sure that all the sterile supplies is place it near the side table kung asa lapit imong pasyente, and then you can apply the dressing. And then kanang mag-pour ta og betadine sa ato ang wet cotton balls. I already have here the supply here. So I'm gonna apply first an alcohol to sanitize my hands. And then after that, open the sterile gloves. Make sure na careful ta sa pag-open sa itong sterile. Kaya once ma-touch na siya sa non-sterile, ma-include na po siya nga non-sterile siya. So, here we have the sterile gloves. So the technique of this is skin to skin and gloves to gloves. And then after that is make sure nga ayuhon na observe ang appearance sa wound sa patient. And then avoid contact with contaminated materials. And then clean the wound with solution. So I will be using a picking forceps. So here. So from the center down and then dispose. Then to the other side, down, dispose, down, dispose, then lastly, center, then dispose. And then make sure to clean the wound area from this contaminated to contaminated area. And then use dry swab. Use dry gauze to swab the with the same manner to dry the wound. And then apply antiseptic ointment if ordered. So apply sterile dry incision. So apply loose woman gauze on for the contact layer. And then I will be using a 4x4 gauze. So I have here a 4x4. So the outside of the peel of the gauze is non-sterile. So I will be using a forceps. And then after that, I'm gonna get a plaster so I can paste it secure. So I already cut a plaster already so that it will be easy for me to paste the gauze on the patient's wound because I'm using a sterile gloves, so I don't allow to touch anything that is non-sterile. And then apply the second layer of the gauze. So I'm then applying the second layer of the gauze, and then we can apply the thicker woven pad if ordered. And for the wet to dry dressing, pour prescribed solution into the sterile basin. And then after pouring the prescribed solution, we can put on clean gloves or the sterile gloves. So same. Make sure to not to touch the sterile area. So inspect wound color and the character of the drainage, type of suture and drains. Clean wound with antiseptic. So this to contaminated area. Or normal saline. So we're going to clean the wound from least to contaminated area. So it should be one direction. So from here to down and then dispose to the other side, down, dispose. And then to the center and then dispose. And then apply fine mesh gauze as a single. And then apply 4x4 gauze. So we're not allowed to touch the pail of the 4x4. So I'll be using this. And then after that, I'm done applying the tape. So I will be removing my gloves and dispose in the waste receptacle. And then remove the face mask and the eyewear. And then assist your patient to be in a comfortable position. So, kayo ma'am, okay ra ba ka? Or like, dili ka comfortable? Okay ra ka ma'am? Okay ma'am, sige ma'am. So, the patient says she's okay. So, I'm going to dispose all the used supply to the waste receptacle. And then after that, I'm gonna wash my hands. So first is I'm gonna wash with a alcohol, and then after this is I'm gonna wash my hands with soap. So that will be all for the wound care. Thank you for watching.